This is a crisis. It is the biggest public health crisis that we are facing now as a state. So we're going to throw everything we've got at it. And we are not going to stop until we've really reduced overdoses. My name is Gina Raimondo, and I'm the governor of Rhode Island. And tackling the overdose crisis is one of my top priorities.
I'm Deb Detter, and I'm the director of the Anchor Recovery Community Programs.
My name is Sarah Dinklage. I'm the founding director of Rhode Island Student Assistance Services, and we've been implementing Project Success in Rhode Island schools since 1987.
My name is Tom Coderre. I'm a senior advisor to the governor, Gina Raimondo. I help coordinate the state's response to the opioid crisis. In addition to that, I'm a co-chair of the governor's Overdose Prevention and Intervention Task Force. The task force set out 4 pillars for the work that they were going to do: prevention, treatment, rescue, and recovery. The prevention work was focused on trying to impact prescribing of opioids.
We know that the majority of people who become addicted to opioids began their addiction with a prescription. And that's why we can't talk about it enough. There are a lot of kids in high school and in college who have sports injuries. They're prescribed a month or two, and then they get addicted. So what we did a couple of years ago, working with the legislature, was to place limits on the first instance of the amount of an opioid that a prescriber could prescribe. And we have seen significant declines in prescriptions and in prescription opioid use. So as we focus on prevention, some of it is awareness, some of it is stigma reduction, but frankly, some of it is mandating how prescribers prescribe so that we can just reduce the supply of prescription opioids in the community.
We knew that if we were going to have a long-term lasting impact, that we're going to have to go even further upstream to primary prevention. The work that's done in schools and in local communities with family members, helping people understand what the risks of using substances were, especially opioids, and give folks the tools that they needed to make sure that they could help their loved ones.
Project Success is a multi-level prevention program, and it's implemented by master's degree level student assistance counselors who are placed right in the middle schools and high schools 2 to 5 days a week. We reach and provide services to children and teens who are living in families struggling with addiction. That could be their parents, their caregivers, siblings. This is a population that often grows up feeling they're the only ones in a family like that. And all the issues that come with that. They are more vulnerable and at greater risk for developing substance use disorder. So by providing services to these kids and telling them they're not alone and teaching them strategies for coping that do not involve going down the same path as their caregivers, we have been successful, and that's something I'm very proud of. It's often difficult to measure success with prevention because we don't often see the reward or the outcome of our efforts until much later. But we have heard from students over the years about how this program impacts their life. Jennifer, age 13, states, "The Student Assistance Program has helped me to be able to talk about my problems in school and at home. A lot of kids start using drugs to deal with their anxiety. The stress techniques I learned have been helpful. I remembered learning deep breathing, and it helped me prevent an anxiety attack."
We are trying hard to focus on the front end of prevention, but when we're not successful, our motto is all roads lead to treatment. And so we're trying to get to a treatment on demand model so that, again, it's all about saving lives.
We have a brand new initiative called BH Link, which is a crisis center, a 24-hour, 7-day-a-week triage center where anyone who's in addiction crisis or mental health crisis can go to this center and get the help that they need.
That means treatment in the correctional system. So we provide the full range of medical assisted treatment in the prison system. I think we're one of the only states in America to do that, and we know that that is saving lives. We're really just trying to be where people are in the community to make sure that treatment is available for everybody at the time that they need it.
Making sure on the rescue side that we're getting naloxone not just into the hands of first responders, but making sure that we're getting it into the hands of everyone who is in the community that could come into contact with somebody who might be overdosing. We're giving out 1,500 to 2,000 doses of naloxone on a regular basis here. We passed a regulation where we now co-prescribe naloxone to people who are at high risk for overdose. So that's a huge milestone for us. And then on the recovery support side, we're really looking at some of the social determinants of health, like housing, jobs, and also making sure that people have educational opportunities so that they can have meaning and purpose in their life and continue into their recovery through those activities.
Here we are at the Jim Gillen Teen Center, which is in Providence, Rhode Island. The really cool thing about a program like this, it's the first of its kind in Rhode Island to do a teen center like this. It's for kids specifically. Some kids are already identifying with being in recovery. Other kids are struggling with alcohol and drug use, and so this is a program where they can explore a drug and alcohol-free lifestyle and learn coping skills and learn how to live as somebody who does not use alcohol and drugs. We think it's pretty cool.
I'm personally very committed to this work, the work of addiction recovery, because I am a person in recovery myself. For me, that means I haven't used alcohol or drugs since May 15th of 2003, so I'm coming up on my 16th year in recovery.
I'm proud to say that New England is really the national leader around this kind of work, doing recovery advocacy and peer-based work. It started first with people in recovery like myself. I'm a person in long-term recovery, using our stories publicly to teach about recovery, to demonstrate that anybody can get addicted and anybody can be in recovery. We really wanted to take the stigma out of what it means to have addiction and out of recovery as well.
It's not an exaggeration to say that I meet people on a monthly, if not weekly basis who've lost their children to an overdose. And as a mother, you hug them, you hold them, you're with them, you realize that could be my kid. As far as I'm concerned, we can't do enough. It's about saving lives. These are our kids, our sons, our daughters, our neighbors, our friends, the people we go to church with, the people we see in the grocery store, and we can beat this. And Rhode Island is a leader, but we have to keep this collective commitment and continue to stay at it until we don't have any more overdose deaths, and I believe that's possible.